Greetings, learners. Welcome to our fifth topic in health and wellness unit. My name is Anastasia Kamwendia, your facilitator in this unit. Today we shall discuss high blood pressure, which we call hypertension. And we need to understand what is hypertension, what can lead to us to develop high blood pressure, what are the causes, and also we can look at the risk factors for hypertension, complications like stroke and heart disease. We want to see how we can be able to cope with high blood pressure whenever it sets in, and also the management to include prevention of high blood pressure. So a brief note about the high blood pressure, when we are looking at a quick reminder, is that hypertension is a non-communicable disease. It's also a lifestyle disease. So once it's neglected, it can lead to other chronic illnesses. Blood pressure is a measurement of the pressure of force of blood pushing against the blood vessels walls. When you have hypertension, or what we are calling high blood pressure, it means the pressure against the blood vessel walls in your body is constantly too high. Another thing we've had of high blood pressure or hypertension is called a silent killer, because you may not be aware that anything is wrong, but the damage in your body is still occurring within your body. So we need to be attentive to our bodies. When we look at the blood pressure, when we take the blood pressure, or a clinician takes your blood pressure, it normally has two readings. The top number is what we call the systolic blood pressure. And the systolic blood pressure measures the pressure on the blood vessel walls when your heart beats or contracts. The bottom number is the diastolic blood pressure, which measures the pressure on your blood vessels when the heart beats, when your heart is relaxing. Fortunately, there are certain things you can do to help reduce your risk of developing high blood pressure. So some of these things that we can do, they include eating right. We find that a healthy diet is an important step in keeping your blood pressure normal. We can add fruits, vegetables, and whole grains to our diet while reducing the amount of sodium or salt that we take in our food. Another thing we can do is keeping a healthy weight. Going hand in hand with the proper diet is keeping a healthy weight. Since being overweight increases your blood pressure, losing excess weight with diet and exercise will help us lower your blood pressure to the healthier levels. We need to cut down on salt as well. The recommendation for salt in your diet is to have less than 1,500 milligrams of salt a day. That is equal to just a teaspoon of salt. To prevent hypertension, you should also keep your salt intake below this level. One thing we need to remember is that most restaurant foods, especially the fast foods and many processed and frozen foods, contain high levels of salt. You can use herbs and spices that do not contain salt in recipes to flavor your foods. Another precaution is that we try to avoid table salt as much as possible. Another precaution we need to take is to keep active. Even very simple physical activities such as walking can lower your blood pressure and also your weight. Those who take alcohol, you take alcohol in moderation. Having more than one drink a day for women and 2 drinks a day for men can raise your blood pressure. So high blood pressure develops when your blood flows through your arteries at higher than normal pressures. And we have seen that when it is taken, when your blood pressure is taken, it's written in two numbers, one above a fraction of two numbers. And we can say that, we can mention and say that the higher, we say if it is 120 over 80, we can say that it is 120 over 80 millimeters of mercury, or just 120 over 80. We have mentioned earlier that the first number is the systolic blood pressure, that is the force of the blood flow when the blood is pumped out of the heart. And the second number is the diastolic pressure, which is measured between heartbeats when the heart is filling with blood. We find that your blood pressure changes throughout the day based on your activities. So your blood pressure is high when you have a consistent systolic reading of over 130 millimeters of mercury or higher, or a diastolic reading of over 80 millimeters of mercury or higher. So what is the problem? A problem that a patient experiences that may indicate disease but cannot be seen and does not show up on medical tests or procedures. Some examples include headaches, fatigue, nausea, or pain. So these are what we call symptoms. Those things that cannot a patient experiences, but they cannot be measured. That's a symptom. Symptoms from high blood pressure don't usually occur until it causes serious health problems. A third of the people with high blood pressure aren't even aware that they have it and are not being treated or to control their blood pressure. That is why it is important to have our blood pressure checked on a regular basis, or at least twice a year. Regular monitoring using a home blood pressure machine is also recommended. So to control or lower high blood pressure, your healthcare provider may recommend that you adopt a heart-healthy lifestyle that includes choosing a heart-healthy dietary pattern, also being physically active and reducing sedentary lifestyle, losing weight for people who are overweight or obese. Those who are smoking, quit smoking. Try to manage stress so that you may reduce your stress levels. Getting enough good quality sleep. For those with high blood pressure, your healthcare provider may recommend medicines to control your blood pressure. And when we control the blood pressure, we are trying to reduce the serious health problems that may arise. We have said it can lead to very serious health problems like stroke and heart. We have said hypertension is typically asymptomatic, meaning that there may not be any symptoms. However, signs and symptoms may reflect underlying end organ damage or potential secondary cause. So some of the symptoms include palpitations, meaning your heart beating fast. You have angina. What we call angina is you have pain, sharp pain on the left of your chest, headaches, blood visions, and then you could also have limb weakness and also be feeling pains here and there. So one may be having an enlarged heart. Some of the signs, if you go to a doctor, you may find that there could be what we call retinopathy, a problem with your eyes. The heart could be enlarged. The heart also may not be having the proper rhythm, the heart beats. And then when your urine is taken, you find protein in the urine, what we call proteinuria. So the risk factors for essential hypertension, we've said, is obesity and being overweight. Also having diseases like diabetes, taking very high salt in your diet, and also a lot of fat, more than moderate intake of alcohol, cigarette smoking, sedentary lifestyle, stress, and also people with a family history of hypertension have a higher risk factor. So in conclusion, we are saying hypertension typically developed over the course of several years. one may not notice the symptoms, but even without symptoms, high blood pressure can cause damage to our blood vessels and also other organs, especially the brain, the heart, the eyes, and the kidneys. So early detection is very important, and that's why we need to go for regular blood pressure readings, because they will help the doctor notice. So if your blood pressure is elevated, your doctor may have to check your blood pressure over a few weeks, different intervals. And if it remains high, then you have to be put on medication, which we should adhere to. Because if the problem is not treated, it can lead to other health issues, including heart disease and stroke. So thank you very much for listening. Have a very interactive session as you go through the activities in this topic, and enjoy the topic. Thank you.